nonprofits as well as another large hospital system. So I have a great appreciation for the role that the University of Kansas Health System offers, both in the state of Kansas and frankly across the country and around the world. We've served people from everywhere. So it has an incredible group of men and women who are committed to quality health care, and I'm delighted to serve in that position.
Committee, do we have questions for Maureen? By the way, her information is on the S drive as confidential. We will be deleting that after today's committee. Any questions for Maureen, committee? Okay, Senator Petty.
I'll just make a comment about Maureen. I've known Maureen for a long time. We've actually served on a number of things together and worked at the Unified Government on a variety of things, dealing with families and children, and she and her husband have been very active in the Kansas City, Kansas, Wyandotte County community, so I can't say enough good things about her.
Other questions or comments, committee? Yes, Senator Clifford.
Thanks for being here this morning at our hearing, Ms. Mahoney. Dr. Clifford, I'm from Western Kansas, so I don't quite appreciate what the health authority does. Can you give me a little insight? Do you set the vision for the health center? If so, I'd like to hear where you envision things going. Thank you.
Well, the health authority obviously created by statute. So we serve as a board the way every board should serve. We don't micromanage day-to-day operations, but we give strategic advice in terms of where we believe that the hospital in its role can go. So I don't know if that answers your question, but you know, I don't have to tell any of you that the world of providing healthcare changes by the minute. So there's a challenge to continue to find the latest and best way to serve people, as well as taking care of those who don't have the resources to access what they need. So there's always a balance. And I think that's the role that the board plays to help our hospital leadership figure out the best way to do that.
Yes, in follow-up, I know there was a step across the border into Missouri. I'm just wondering how that's going.
We did. We moved up into Liberty. And actually it's going great. We've expanded, we expanded into Olathe, and as well as our flagship in Wyandotte County, of course, in parts of Johnson County. What we bring is an expertise of how to provide healthcare and a way to use your resources the best. So we've reached out. Of course, the folks from Liberty seem to be delighted with the results, and to have the KU name affiliated with them in terms of our national recognition in terms of what we're doing in cancer and a number of other disciplines that we're recognized in nationally. It seems to be a benefit for everyone. Thank you for asking.
Thank you, Madam Chair.
Additional questions, committee? Seeing none, thank you so much for being with us today. And committee, we are now going to open the hearing on 2039, and we'll start with a bill brief from Jenna.
Good morning, committee. Thank you, Madam Chair. House Bill 2039 amends definitions in the Kansas Credentialing Act related to certain entities providing physical therapy, occupational therapy, and speech-language pathology relating to home health agencies. This bill amends KSA 655101, which is the definition section for the act that governs home health agency licensure and regulation. Subsection C2 adds new language to exclude certain types of providers from the definition of home health agency. The bill provides that entities who are not reimbursed by Medicare Part A and that only provide the services of individuals licensed or certified to provide physical therapy, occupational therapy, and speech language pathology are not home health agencies, and thus they would not be required to follow the licensure or regulatory requirements of the Act. The bill would take effect upon publication in the statute book July 1st. There were no amendments, and the bill passed out of the House on a vote of 119-0. And I'll be happy to answer questions.
Any questions for Jenna, committee? Senator Thompson.
Thank you, Madam Chair. Thanks, Jana. So in other words, by exempting them from these, they would be available for home health care without the licensing. Is that correct, or am I understanding that incorrectly?
That might be a good question for the proponents.
Okay.
This bill would just say that if you only provide these 3 types of services and that's all you do, you are not required to be a home health agency. The individual providers would still be required to be licensed as physical therapists, speech language pathologists, but not as a home health agency.
Okay. Just wanted the clarification. I may ask that again. Thanks, Madam Chair. Thank you.
Additional questions? All right, seeing none, thank you, Jenna. Our oral proponent is virtual today, Stephanie Underwood. Are you with us? Can you hear us?
Are you able to hear me?
We can hear you now. Go right ahead.
Okay, perfect. Thank you. Good morning, Chairwoman Gonzalez, Vice Chair Clifford, Ranking Member Holscher, members of the Senate Health and Public Welfare Committee. My name is Stephanie Underwood. I'm the General Counsel for Fox Rehabilitation. We are a Part B provider of outpatient physical, occupational, and speech therapy services in the homes of older adults. We're currently in 36 states, including DC. We are not a home health agency. We do serve complex patients. Our average patient's 82 years old with multiple comorbidities. And what we do is we fill the gap between patients that are not homebound and need outpatient therapy services, but have difficulty or frankly no desire to go to traditional brick and mortar outpatient clinics. About 60% of our services across our footprint occur in assisted living facilities, and the other 40 are in residential homes. So within assisted living facilities, we often partner, i.e. we act as a subcontractor for home health agencies to provide therapy services to patients that are on their service. And if patients that are not home health eligible, so they're not homebound, we provide those services directly under Medicare Part B. And what we're looking to do here in Kansas, we want to be able to expand our operations to conduct our traditional house call model. The current statute regarding home health services appears to include outpatient practices that provide therapy in the home. So we're proposing a clarification to the statute that would allow Fox to provide services as we are allowed to under Medicare Part B regulations relating to the outpatient providers. We have the support of Phoenix Home Care and Hospice, who has spread a written testimony, and Via Christi, two of the largest home health agencies in the state. And we have also spoken with and provided information to the Kansas Physical Therapist, Kansas Occupational Therapist, and the Kansas Medical Society. I appreciate your time in discussing this matter. I hope you will support our legislation that will open access to care for older Kansans. And certainly I am available for questions. Thank you.
Committee, are there questions for Stephanie? I have one, Stephanie. We know that Medicare Part A pays for inpatient in a hospital, nothing outpatient. We know that it pays for short-term in a skilled nursing facility, and also pays for hospice care. So knowing that, when I read home health agency, it means a public or private agency or organization or subdivision or subunit of such agency or organization that provides for a fee for one or more home health services, supported care services, attendant care services provided under home and community-based services waiver programs at the residence of the patient. It sounds like that's exactly what you do. So I'm trying to figure out why you want to be eliminated from this definition.
Sure. So we are an outpatient provider, not a home health provider. So all those services sort of that you just mentioned that are under Medicare Part A are not the services that we provide. So in the 36 states that we're in, typically what we find is the definition of home health services usually is nursing plus one of these services that we provide, PT, OT, or speech, not all of those services separately qualifying for home health agencies. So for us, it's just a different line of business. And so it tends to be difficult to fit ourselves into a statute that really seems typically to be based on more of the traditional home health model, which is not what Fox does.
And so is there a complication that you would be fitted within the definition? Forgive me, I'm just trying to understand. What does it hurt to be in the definition?
Sure. I mean, home health agencies are facilities. So oftentimes what it does to us is we're then required to get facility related things like so when we're inside of an assisted living facility, that facility itself has requirements of a facility. For us as an outpatient private practice, we do rent space in there, but then these laws tend to then take those responsibilities of the facility and put them back on us as well. So things related to, I mean, it could be anything from needing a phone, needing to have someone available 24 hours a day, despite the fact that our services are not acute, having to provide just different leaving papers on the desk, having to authorize services more frequently than we need to, recertifications occurring faster than they would in a Part B setting. Those types of things administratively make it much more complicated to run the business because they're just not the same. You know, home health agencies don't do outpatient typically, and outpatient doesn't do home health because they're just different. They're just different business models that have different requirements from one another.
Thank you. Committee, other questions? Yes, Senator Rose.
Thank you, Madam Chair. As far as the impact on Kansans is concerned with this change, I know on Medicare Advantage plans, the cost share for home health care is $0. The cost share for physical therapy is about $20 or $30 per session. So can you please tell us the impact this will have on your patients and their out-of-pocket costs?
So we are under Medicare Part B, so they always have to meet a deductible to get our services. Our patients are not homebound. So I think what you're referencing, right, is the Part A benefit versus the Part B benefit. We only bill Medicare Part B. So in all instances, our patients will have the Medicare Part B copay. But what we do that home health doesn't is home health, the objectives are different. So if you're a home health provider, your goal is to get that individual patient to be no longer homebound, right? You're trying to get them medically stable. We are trying to get them functionally well, meaning that if your goal is to garden, if your goal is to walk your granddaughter down the aisle at her wedding, like our goals and our focus is on those functional differences. So home health doesn't provide the same amount of therapy that you can get under Part B because the goals are different and the payment models are different, and therapy under Part A is de-incentivized in the payment. So it's just a few sessions, we get you off of the homebound status, and then you would move over to Part B if you're still eligible, and most likely are, for services, and then we would continue on to get that person functionally well and get them doing whatever it is their goals are. So there's a different focus for A and B, and therefore there are different cost structures, but those cost structures are under the Medicare umbrella. They're not really anything that Fox itself impacts. Does that answer your question?
As an agent with some clients in Medicare, I know that there's different cost sharing for home health care compared to physical therapy and OT. So I just think we need to be mindful of that. And so thank you, Madam Chair.
Did you have another comment, Stephanie? No.
No.
Okay, Senator Petty?
Thank you. Stephanie, so am I understanding that your model is that the billing is not through you, but it's through, it's from Medicaid Part B directly to the clinician? Would that, or they do direct billing?
Okay, so we're Medicare Part B. So the way that we're set up is that each clinician is separately, individually credentialed with Medicare. So they have their own MPI number. They take those benefits, the individual, their individual MPI, and they connect it to our group MPI. So Fox does the billing on behalf of the individual therapists that we employ. They are all W-2 employees. They just assign the right to collect the billing on behalf. So Fox does the billing and we collect on behalf of the individual therapists, but they are all individually credentialed and licensed with Medicare versus home health, where the agency bills on behalf of all the individuals, and those individuals aren't necessarily, well, they don't need to be independently credentialed with Medicare. In Part B, everyone is independently credentialed.
So all of the speech therapists, physical therapists that work through Fox are credentialed through Medicare Part D. I mean, their credentials are, they are credentialed through their organization, but they are credentialed through Medicaid Part B. Is that correct?
Medicare part, yeah. So,
Thank you.
like a physician, same idea.
Thank you.
You're welcome.
I think just to clarify for people who may not be as aware of Medicare, A is only going to be if you're an inpatient at the hospital. Any physical therapy, any doctor's office visit, any outpatient surgery, any of these things are all funneled through Medicare Part B.
Correct, yeah, they're all outpatient services. So we are an
Right.
outpatient provider. Yeah.
Correct. Okay. Committee, other questions? All right, seeing none, thank you so much, Stephanie, for being with us today. And committee,
Thank
I
you for
would,
having me.
I would point your attention to the proponent's written only testimony from the president and partner of Phoenix Home Care and Hospice, Springfield, Missouri, and his name is Alex Milligan. I think I said that right. And thank you all for being here. Malujan. Thank you. I said it completely wrong. All right. Thank you all for being here. This closes the hearing on House Bill 2039. And committee, we are adjourned.